I was diagnosed with breast cancer in 2009. I went through surgery and then I had to have radiation and chemotherapy. Um, it, I had no idea that as a ramification of doing the chemotherapy and being on tamoxifen that I would be suffering from the vaginal dryness that I suffered from. That started probably a year or two after I had my last treatment. My doctor did try to help me with some different kinds of topical estrogen and estrogen pills in the form that I could take vaginally, because I was not allowed to take anything orally because I had estrogen and progesterone positive cancer. I had become increasingly more frustrated and visited with my GYN several times. I've spoken to my breast cancer surgeon. I even spoke to my oncologist about the symptoms that I were having that were becoming quite severe. So severe, in fact, that I could not have vaginal penetration at all. And I thought my sex life was over. So just one visit with the GYN, she said, I've heard of this treatment called the Mona Lisa treatment. And I thought, well, that's kind of a hokey name. But she said, I don't know anybody that's doing it, but perhaps it might be something you want to research. So I went home and I researched the Mona Lisa treatment. I chose the Philadelphia Center for Sexual Medicine because of the fact that they were a sexual medicine practice. There were some GYNs that did them in an area that I was familiar with outside of the city that seemed to have it. But I went to a specialist for oncology. I went to a specialist for breast surgery. I wanted a specialist that understood my symptoms, not just a GYN that had decided they wanted to do this treatment. I was very nervous at first. Dr. Gittens put me at ease. He was very good at doing that. I was very nervous. Just the simple penetration of the device was very scary for me. But it wasn't even close to being as scary as I thought it was going to be. It was quite easy. I started feeling relief as far as the comfortableness of my vaginal area after the first treatment. As far as like sexual penetration, vaginal sexual penetration, I started feeling that probably it was the best after the last treatment. I can't recommend this treatment enough because we don't talk about it. We're just happy to be alive after breast cancer. Dr. Gittens was, what impressed me is I believe in evidence-based medicine, so I did my research. Well, Dr. Gittens knew lots more than me. So I was impressed with his intellectual knowledge. I was impressed with his caring attitude towards me. I had not had a male GYN doctor in I don't know how many years and was nervous about that, and I never felt nervous with Dr. Gittens at all. He put me at ease, and his staff were, they were very, very friendly. Dr. Gittens has the experience with the device. He customizes it for your needs. I think that's very important. Sexual medicine is his practice. I thought it was unusual when I first walked into the office. Now I proudly walk into my sexual medicine office. I am hoping that more women get to know about this. I tell anybody that has ever had a problem that I know that's had breast cancer, that's having any issues, because we really don't talk about it. We're supposed to just be lucky that we're alive and that our treatments have ended, and that's it. And nobody seems to care about the fact that we're young women unable to have sexual intercourse for the rest of our lives because of this condition. It's not even that. It's the discomfort that you can just be sitting in clothes and feel uncomfortable in that area. And I just can't praise this office enough. I can't praise Dr. Gittens enough for what he did for me and how he made me feel better.